I'm Bill Boro. I practice in Annapolis, Maryland. The topic of my presentation is the relief of neurological symptoms secondary to surgical removal of a thoracic astrocytoma and the symptoms relieved by Category 1 block placement. So the purpose of this presentation is to discuss the clinical course, the treatment, and the positive response of the female patient to Category 1 block placement in relief of her paresthesias. That the blocks created immediate response, lasted for many hours, and was repeatable. And also to provide a theoretical understanding as to how the block placement could help this condition. So what's a pilocytic astrocytoma? I had no idea. Basically, the pilocytic refers to the shape of the astrocyte cell, that it's hair-like projections. That's where the pilo part of it comes from. And it's also called juvenile pilocytic astrocytoma because just about all of them occur in children. It's very rare to be in someone over the age of 30, and it's the most common CNS neoplasm of childhood. It's considered to be benign and have a favorable prognosis. It can be extradural, it can be subdural and extramedullary, or it could be intramedullary within the spinal cord itself. Hers was subdural and extramedullary with possible projections into the spinal cord. So I want you to imagine that you're a 27, 28-year-old pretty young lady. You are vivacious, positive attitude, and you just got married and you look like Charles. No. And so you married a nice, handsome young man. You both have great jobs. The world looks great. Fast forward 3 months. You start getting back pain, upper back pain every night. You turn your head and you get shocks down your left side. You start driving down the road and you turn your head to look at the traffic and your foot jerks off the gas pedal. She thinks something's wrong. Goes to a neurologist, neurosurgeon, do an MRI. She's got a 4-inch tumor in her thoracic spine. They take her to surgery, and they try to remove the tumor. They leave 10% of the tumor in the canal because they thought if they removed the entire tumor, she would be paraplegic. So you wake up after the surgery, and you can't walk. You got back pain. You got no feeling from your abdomen down, from your diaphragm down. No vaginal sensation. Can't go to the bathroom. And also a persistent buzzing in her legs, a feeling of buzzing like bees are wandering around and irritating her. So she presented to my office 9 months after surgery with all these different symptoms. I forgot to say projectile vomiting. She lost her menstrual periods. And I said that the tumor is benign and considered to have a favorable prognosis. She said the doctor told her that she would be 95% recovered within a year. I suspect what the doctor really said was that within a year you'll get 95% of any improvement that you're going to get, because a lot of these people, as you can see, are unchanged or aggravated. If you're ever feeling depressed and having a really bad day, there's a Facebook page of Spinal Cord Tumor Association. And you read that and you will feel terrific. These people, it's just a sad situation. So, as I said, prior to coming to my office, she had physical therapy for 9 months and ongoing while she was in treatment in my office. Aquatherapy, land therapy. I use a combination of analysis and treatment techniques, including Sacro-Occipital technique, Van Rump non-force technique, clinical kinesiology by Beardall, and Jean-Pierre Barral's visceral manipulation. She was referred to me by the physical therapist because they knew that I did some visceral work and thought that maybe something could be done with her constipation or things like that. But she had so many structural things going on. We adjusted her cranium, full spine, extremities, the ribs. Ribs were unstable. Took a bit to get them together. Soft tissue release techniques around the incision, because the incision, if you touched it, it would trigger the buzzing and really make her nauseous as well. Did some visceral adjustments. And she presented initially with a category 3, converted to a category 2, and then category 1 findings showed up. And serendipitously, I discovered when I put the category 1 blocks on her, the buzzing in her legs disappeared within 5 minutes of block placement. So I treated her at category 1 about 2 or 3 times, and every single time, the buzzing disappeared. So she was going to Mexico for 2 weeks with her husband for a little vacation. So I gave her a set of blocks, taught her how to self-treat, and she went to Mexico. And for those 2 weeks, I mean, she had a wonderful time. You know, she could, activities of daily living increased, less symptoms, and really enjoyed herself down there. So what's going on? Well, we all know that the dura attaches to the cranium, attaches basically the occiput, attaches to the cervical spine with ligaments of Hoffman, I believe it is, and then, I'm sorry? Hoffman, and through the, that's ligament flava, posterior longitudinal ligament, denticulate ligaments to the thoracic spine. Well, there are also anterior ligaments of Troland, I believe, attaching to the anterior sacrum. Alf Brieg was a neurosurgeon in the 60s, 70s, and 80s, and wrote a book, if you're not familiar with it, The Adverse Mechanical Tension in the Central Nervous System. Excellent book. And he states that if there's tension created in the pons cord tract, it can result in symptoms of neurological deficit and excitation or hyper and hypofunction of various organs. He also said that if you remove that lesion, you'll get relief of those symptoms. Again, what causes the paresthesias? Well, back in the 40s, 2 doctors wanted to see if they could recreate, you know, pins and needles. So in an article titled Pins and Needles, what they did was they took a blood pressure cuff, put it on somebody's arm, squeezed it up, and left it on there. You know, within a few minutes, what do you know? They got numbness, tingling, pins and needles, and so on. And if you let the pressure out, the symptoms would go away. So they said that these pins and needles and paresthesias were due to mechanical deformation of the nerve, lack of oxygen, metabolic metabolite accumulation, and that you lowered the threshold to stimulation by any of these previous causes and or combination of these things. So category 1, what is that? It's the dura, torsion of the dura. D. Jarnett said that correcting category 1 will correct rotational malposition of the pelvis. It'll relax the paraspinal musculature. It calms the proprioceptors, affects the spinal dural tension and traction of the spinal nerves, removes the dural torque, aligns the dural ports, and frees up the dural port constrictions. And how does it work? Well, those torsions, the tensions, deformation created by the spinal dural torque and the scar tissue, I believe, created that buzzing and increased the sensitivity around the laminectomy scar. So by blocking, you release that tension, you increase the cerebral spinal fluid flow, you get improved removal of the waste metabolites, increased oxygenation, and also the category 1 blocking can create relative flexion extension release of the sacrum and the rest of the spine. But do we have any real proof, hard proof of that? Well, thanks to Dr. Vincent Esposito, we have a video that he did of pre and post treatment on a patient. So he did a cine MRI study.
See, then it'll be much brighter and much more descending down. And you can see here the focusing the ventricles. It's almost like a milky type effect.
So prior to treatment, it's kind of dull.
One of the surgeons, two. If you look down the cord, it's surging down the cord. The CSF was going barely. Obviously, she was alive, but now she's alive.
Okay. So you can see the change in cerebral spinal fluid circulation by his treatment. In conclusion, like I said, I worked with her for the last 4 or 5 months. After she returned from Mexico, she was able to hook up with Kennedy Krieger Institute at Johns Hopkins, which is an elite organization for dealing with spinal cord tumors and injuries. So I haven't seen her much in the last couple of months, but her 12 weeks are over there. She's coming back to my office. But during the 3 months, 6 months, well, about four or 5 months of treatment, she got more feeling in her feet. Low back pain was significantly diminished. Rib stability was there. Marked improvement in her balance. When she came to my office, she was using a walker. Now she's occasional cane usage. And reduced need of medication. She was on 5 or 6 different medications, including morphine. She had to inject her intestines with Relistor, I believe it's called, in order to have a bowel movement. Well, that's changed. She now can do it with an enema or even not even requiring an enema. Her menstrual period came back. But again, the issue of this particular case study was the relief of the buzzing in her legs. That anytime she feels that buzzing, and it's accentuated by her work at Kennedy Krieger, she can place the blocks, and within 5-10 minutes, the buzzing goes away, and it can last for 2 to 12 hours. So just that, I thought, a serendipitous discovery, can help any of these patients who suffer. So conclusion, again, this might be by chance, but it's obvious that there is a subset of patients who may respond to the application of Category 1 blocking, and that hopefully this could encourage you as a practitioner, if someone you know of or is told that has this kind of problem, that maybe there's something you can do for them. Like I said, having someone like this walk into your office is not what I wanted, but she's been a source of a great education, and she is extremely happy because arriving in my office prior to that, she had pretty much no hope because none of the medical doctors knew what to do with her. Physical therapist just kind of a lot of exercise and abused her. And 9 months after surgery, she was really in bad shape. Now she's almost going to be like a human, hopefully. So thank you very much.